NHS is a service almost all of us will have turned to for help or care at some point in our lives. But the organisation wouldn't function day to day if it wasn't for the staff who work there. Our reporter, Hope Webb, has been to meet the Dunabies, 3 generations from the same family who have dedicated their working lives to our health service.
Our plan is a service which will provide the best medical advice and treatment for everyone. There'll be no charge for treatment.
Granny, mum and son, they have a lot in common, most of all though the NHS. All 3 generations have worked or currently work within the health service. Tricia started the trend in the 60s when she changed careers.
Initially he worked at Grant's Distillery in Girvan and then got fed up there, saw an advert in the local paper that said, would you like to be a children's nurse? And I thought, oh, I could do that. Right, this is at Seafield Hospital where I trained, and that's me there and some of my colleagues. You saw an awful lot of diseases that are not here anymore and an awful lot of conditions that are not here anymore due to better health care.
Lesley grew up listening to her mum's stories of the NHS.
And it was always really fascinating. I have a distinct dislike for anything medical and blood or injections and things, so I would tend to close my ears for those bits. But yeah, it was really fascinating and very inspiring to hear your stories. It's where our children and young people normally come to sit and wait for their appointment.
Lesley now works in children and adolescent mental health services at NHS Forth Valley. She's determined to carry on her mum's work supporting young people.
Almost 25 years next year, and yeah, I'm really grateful that I've been afforded this opportunity, and it's great that my son's following in my footsteps.
Helping somebody is important, and it's something I kind of looked up to my mum for. She worked in the same sector for a long time and she's built her way up, and she's told me many stories of working with individuals she's helped, and it really kind of inspired me to want to become a mental health nurse.
These can be used.
Brodie is the future of the NHS. He dreams of working in community mental health, but right now he's learning the ropes at the University of the West of Scotland.
It's a really rewarding job morally, and it you just feel at the very end of the day you've done something good.
For now though, he's focused on his exams and summer placement in a care home, but he's got his mum and Gran to turn to for advice, and Granny is always right.
Well, the more placements you have and the more kind of experiences you have with different stages of mental health, I think it'll be wonderful.
Tricia, Lesley and Brodie are only 3 examples of a huge NHS workforce across Scotland, but they represent the core values at the heart of the health service for the last 75 years.
As a national health service, that's what it was set up to do, to treat everybody with every condition. And I do hope it continues, and I'm sure it will continue.